Hello, everybody. This is Gary. Today is Sunday, December 25th, 2022. It's Christmas Day. It's 5:09 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, my auditory hallucinations are not that bad. My paranoia and delusions are not that bad. My anxiety levels are pretty high. My physical pain in my right knee is pretty intense. My depression is not that bad today. Um, Today I didn't do much for Christmas. I just stayed home. I did go outside earlier for my physical therapy and walking exercises, and it's cold as hell outside. There's not much snow on the ground, but it's very, very cold in Rochester, New York. Um, I'm seeing my new therapist this upcoming Wednesday on the 28th. Today's the 25th. I was told that I had a new therapist when I went to see my therapist last week. Um, and my old therapist is going to sit in on the meeting with my new therapist to make sure that the transfer is as smooth as possible and any wrinkles are ironed out between me and my new therapist. I'm not sure how often I'll be seeing my new therapist to begin with. I would like to see them more frequently to get to know her better. It is a woman, and my last therapist was also a woman, which is what I requested. I don't do well with male therapists. It often gets very confrontational when I have a male therapist, so I did request a female therapist, and that's what I'm getting. Um, I'm seeing my psychiatrist week after next. I don't suspect to be changing any of my medications or anything like that. Um, I doubt that there's going to be any need to make any changes in my medication. We already reduced my Zyprexa, the antipsychotic that I use for paranoia, because it caused possible urinary retention, which I had to go to the emergency room a couple weeks ago. They had to insert a urinary catheter, and they didn't remove it until a week and a half later. And then I spent some time in the emergency department for possible internal bleeding. Um, but physically, I'm doing okay. It's just that I have a lot of pain in my right knee. I had surgery on May 13th earlier this year, and the pain in my right knee and the stiffness is still there. That's why I try to exercise my knee and my legs every day to reduce the stiffness and pain. I still take Tylenol for pain. Um, I'm still on Cymbalta for physical pain, Neurontin for physical pain, Flexeril for physical muscle pain. Um, and like I said, I'm still taking Tylenol. Um, I'm still on 600 milligrams of Seroquel at night as an antipsychotic and mood stabilizer. I'm still on my stomach medications. I'm still on my blood pressure medications. Um, I'm still on all the other medications that I was on before. Nothing has changed in that regard. My primary care hasn't changed any of my medical medications. I'm still going to see my primary care provider, I believe, in uh, March of April next year, sometime around there, something like that. In February, I'm seeing the urologist just to follow up on the urinary retention. Um, but beyond that, there's nothing else to report on. I hope everybody has a Merry Christmas.